say I had to put cameras up my backside and down the throat, and so that's all normal. Then when I went back to the clinic, the specialist who'd done these tests said that he wanted to get some other GP to do some sort of blood test, because he said there was something about the platelets were a bit low. I'm not even sure what they are. So I turned up at the surgery because they asked me to come for this blood test. And I did the blood and so on. That was about 3 or 4 weeks ago. And then I got a message, could I go back to check it again? So I went and did another blood test, not quite sure why. And then I got a letter last week, said could I make soon as reasonable. It said it wasn't sort of urgent, but you know, sort of, I can't remember what the term was. Could I make an appointment to come back, sort out the result? Because they wanted to talk about the result. Here I am.
Okay. And did they tell you exactly what the blood tests, why they were doing
something
the blood
about immune something and platelets or something? I didn't really quite know what it was all about. I just thought, well, it's just a test and done. Yeah.
Were you told that you were being tested for HIV?
Christ. Is that AIDS?
No, it's slightly different. It is connected, but I'll explain that to you.
I wasn't told that. So it worries me now you say I've come back with the result. Does it mean it's positive?
I'm very sorry. You know that you haven't been told and explained what this test was, why you were having this test done.
Well, is it positive? So from what you're looking at,
it is indeed.
It
yeah,
is.
it is indeed positive. I'm sorry about that.
Yeah. Yeah. I just feel perfectly well, and you know, this is a sort of random. You know, it's just sort of. Yeah.
Okay. I mean, are you unhappy about the fact that you were not told?
I'm unhappy about the result of the test. It's not so much whatever I was told. I mean, you know, I'm trying to get my head around the test. Never mind anything else. It's what's going to happen, and you know, what does this mean, and all this. You know, everything's.
Sure. Okay. Well, I'll tell you what happened. Can I ask you something more about yourself? I understand you work as a department manager. In
I work at Aviva Insurance. Yeah.
And do you have any? Who do you live with?
Well, I suppose technically I'm on my own at the moment. I've had a few girlfriends over the years, and I haven't had any boyfriends, because this is something you got from homosexual, isn't it? Unless you're in Africa. But I met a girl about 3 or 4 weeks ago, and we've been out to the theatre and this sort of thing, and going around there for supper at that place tomorrow, and then the relationship sort of beginning to pick up. So I can't say she's a regular, you know, I haven't been with her ages, but I've got, I guess she is a partner, really. What am I going to tell her? Because, you know, nothing's happened sexually so far, but,
well,
you know,
that is something we can discuss today. Now, just to start off from what your first question was about HIV and AIDS. HIV and AIDS are linked because of the same virus, but everyone who's HIV doesn't end up having AIDS. AIDS is the most serious.
AIDS is when you're actually ill with it, rather than just having a positive test. That's
right. Yeah, but you know, medical science has advanced these days, and we can actually, most people end up with HIV. End up living a normal life with the help of some medications, some antivirals.
Yeah.
So, you know that.
So not everyone just dies of it, which was what I thought happened.
No. It used to be the case in the 80s, but things have changed now. All that you will need to do is to keep regular checkups and keep up with your regular visits and checkups, and make sure that your blood count is not, falling to below a certain minimum. So that's one of those things. So the fact that you have got HIV wouldn't mean that you will end up having AIDS as long as you carry on.
Presumably infectious. You can sort of, can you kissing someone? I did have get a snob woman girl like that. Would that cause her to get AIDS?
No, kissing doesn't cause. AIDS to spread, the HIV to spread.
HIV rather than
HIV to spread.
Yeah.
But what can actually spread is sexual intercourse or any change in body fluids and stuff like that. Like blood, if you donate blood and stuff like that, that could.
I used to do that years and years when I was a student, but I haven't for 10, 15 years now. I mean, since I gave blood, because they test blood for AIDS, don't they, when you donate, do they?
That's right.
So,
yeah. But another question was about how you got that. It can, as I said, sexual intercourse. It doesn't have to be a homosexual intercourse. It can be a heterosexual one. You may have got it from one of your partners previously.
You just practice safe sex. I was with a girl in South America when I left university, but she was on the pill, so we didn't. It's an American girl I met, and we were together travelling around for a couple of months, and nothing was good. That's about the only.
Okay. But it is really important, Mr. Worsley, what's very important is I would encourage you to share this information with your partner who you're sleeping with at the moment.
Well, I'm not sleeping with her. As I said, I assume it might well go in that way, if you see what I mean.
Sure,
but yeah.
I would encourage you to do that, because that will prevent the spreads of the virus, and will make you feel better. Actually,
does that mean I have to be celibate for the rest of my days? I mean, what does it mean?
No, it's well. Legally, you don't have to say anything to anyone, but it will be a good thing to share this knowledge that you have, and so that at least you wear protection. If she does agree to having sex and stuff, you could wear protection, and she's aware about
condoms and things.
Yes, that's right.
Pretty much guaranteed to prevent transmitting.
It's not, but it does reduce the risk slightly. Now, as far as the fact that if she does get pregnant or something like that happens, then there are certain things that can be done to prevent the transmission of the virus to the baby as well. So it's really important.
There's a hell of a lot to take in all this.
I'm sure it must be very bad news. The important thing here is, before we end, is if you feel unwell at any point because your platelet count is low, if you have bruising or bleeding from anywhere, if you get a temperature, cough, it will be very important that you just establish a contact with any of the doctors here or out of ours straight away.
What about the HIV business? You said something about medicines and treatment and
That's
things,
right.
And modern medicine science. What actually is going to happen? Because obviously I want to get on and try and sort this out as soon as possible.
Yeah, that's right. What we're going to do now is basically refer you to a specialist who deals with HIV, medications and stuff, and they'll put you on a certain medication and deal with that. It's microbiologists we'll have to contact first of all, and in the hospital, and they can certainly advise us what medications you need to be started on, and pretty much sooner rather than
So it's sort of outpatient sort of thing.
Yes, that's right.
Doesn't,
And do you have any questions?
If it's such a lot to take on, I sort of got to think where we go, and I was going to redo my mortgage, my house. I mean, does it affect life? I'm in insurance, and I can't even get to know all this, but something, life insurance will be affected by it being HIV, can't it? Positive.
I'm not 100% sure about that, but there are.
That's what
there
I
is
have to tell. What I just really hardly know where to begin. It's such a lot to take on board.
Sure. Would you like me to give you a contact telephone of a person who can advise you on or perhaps you can even look into websites and forums and stuff like that.
I'm not going to get my head around it now. I mean, what I need to know is what the next step is, and
So
going to do a lot of research on the internet and things, of course.
Sure. The next step I would suggest is if we get in touch with a specialist, seek their advice on which antiviral drugs need to be started. Any problems, any illness, any bruising, bleeding.
Right.
Come back.
And they'll contact me. You're going to send them a referral or something. Is that what's going to happen?
They will contact you straight away.
Okay.
Thank you.
It's about. Sorry, I heard it.
Yeah, it's very quiet.